Good evening to all the viewers of IWSO. I Want Second Opinion. Welcome back to this channel. Please subscribe and share it to as many people as you can because we are going to be benefited out of this. This is a free service rendered to the public to get all our doubts cleared, not only about the various medical conditions, but also about our well being. So please do share and subscribe. And
Thank you.
today's topic, hi, doctor. We are again
Yeah,
with
hi.
Dr. RP today with another major issue which everyone faces, back pain. So, this is going to be the topic of discussion today. Let's begin straight to the topic. What are the causes of back pain and how to go about it, the treatment part?
Sure. See, back pain is a vast topic to cover, but let's keep it precise and concise in this particular discussion of what we are having. Uh, Before going into the causes of the back pain, let me tell you there are broadly two categories of back pain. One is the acute back pain, which means it starts for a period of few days and then lasts for less than a week. At that point of time, it peaks and then gradually tapers down. The second is a chronic back pain, which is essentially it is a smoldering kind of a back pain, which might be of low intensity or high intensity. And by definition, chronic back pain is any pain which is more than 3 to 6 months duration is chronic back pain. So people with acute back pain, they tend to have it on a recurrent and a frequent basis, and they tend to forget about it. Whereas chronic back pain is a kind of a debilitating condition. Even if you've got a headache for say an hour or so, it is so pestering and it is life altering. Imagine having back pain for almost few months, which is not settling down, and it is giving you problem. Means then it is definitely a problematic situation. Now, having said about the acute and chronic back pain, let's talk about the individual causes of the back pain. The first one, which we can talk about, is the traumatic kind of a back pain. So, for example, if somebody is walking on a pavement, they trip and fall down, or involved in a road traffic accident, or if they are going to be involved in sports injuries and stuff like that, what happens is I will show you the model of the bone. See, this is the model of the bone. This is just a skeletal model. In addition to that, it's all covered with the ligaments over here, all the muscle over there, fat is over there, the skin is over there, etc., etc. And in the vertebra itself, it is made up of nearly many components. There are multiple joints, as you see. These are all the joints over here. That's the bone over here. There's a disc over here. So lots of components are there. Anything can be injured when you fall down. And depending upon the severity, whether it is if the fall has led on to a simple sprain or something of that sort, it is going to ease for a period of time. Whereas if it's going to cause a tiny bone fractures or a severe bone fracture, then accordingly it will take time to heal. So first is the traumatic kind of a back pain. The next one is the degenerative cause of the back pain, and this is the most commonest cause of the back pain, which I'm sure I'm going to give a specific time to discuss degenerative disc pathology as a separate topic. But in nutshell, what it is it is an age-related wear and tear of the spine and spine-related structures. So that's what it all comes up to. Normally, aging is not a pathological process. We have discussed in the past. It is a physiological process. Whereas, in the presence of the aged spine, if we are going to put too much stress and strain to that, this physiologically aged spine is not going to cope with the stresses and strains of our life. And so what will happen is it is going to show its anger onto us. So, and that will lead on to symptoms, etc. So that is a degenerative kind of back pain. The next one is the infective kind of back pain, in the sense that, like any other part of the body, our bone and the muscles surrounding it, the ligaments, the disc of the vertebra, everything is susceptible to get infected. Like it can be a bacterial infection, or it could be a fungal infection, or it can be the tuberculosis, which is prevalent in India. So all these can cause infection of the bone and bone related tissues, and this can cause infective kind of the back pain. The next one is the muscular kind of back pain.
Muscle.
Like as I told you here, this is just the bony anatomy, but this is all covered completely with muscles and stuff. So if we are going to cause any, if for example, if you are going to lift something heavy, what will happen is it is going to sprain some muscles in the back, and or if you are going to bend awkwardly, then once again you are going to get a catch in the back, and that is a muscular kind of a back pain. The other variety is a kind of a, it's called as a postural back pain. Like if you're a plumber by profession, or if
Yes.
your occupation is going to be involved in any kind of an abnormal or awkward positioning, or for example, imagine you are sleeping in the bed in the night with a kind of a pillow that is not very ergonomic to your neck. The next day morning you wake up with severe stiffness and ache in the neck. So likewise, very similar can happen in the back as well, and this can be attributed to postural kind of a back pain. The other one is a sinister one, which one needs to be putting it in the back of the mind and forget about it, is essentially is the malignancy related. So what I mean by malignancy is cancer and cancer related issues. So what it means is, if there is going to be a subtle cancer in some other organs of the body, which one may or may not know, or any cancers that are developing in the bone itself, or blood cancers and all this kind of stuff, can present itself as an insidious origin, in the sense that without knowing, it will start slowly and then it will build up gradually, mainly associated with weight loss and too much of night pain, and all those kind of stuff will happen. So one has to keep this in the back of the mind, as but not to be too much alarmed regarding whenever a back pain, oh, am I having a cancer or something or so. No, it's not. It is a rare condition, but a condition that one should not forget and ignore it. If one ignores it, then it might become detrimental for it. So that is there. Then comes the group of like I told you about the acute and chronic back pain as two broad categories. I can also categorize other kinds of back pain, like surgical kind of back pain and non-surgical kind of back pain. The surgical kind of back pain is the one wherein we as surgeons, we can do something about it in the form of treatment options that are available under our purview to try and make the patient better. Whereas non-surgical kind of back pain, these are all not amenable and they don't come under our control as spinal surgeons, but they do come under the care of the physicians and the pain consultants and stuff like that. The examples are, one is the inflammatory condition of the back pain, which is essentially like, for example, you might suffer from rheumatoid arthritis or ankylosing spondylitis and all those inflammatory diseases. What happens in that is, it is not just the disease of the spine alone. It's an inflammatory condition of the whole body, wherein majority of the organs of the body are affected. As a result of which, they will be having whole body pain along with multiple joint involvements and stuff like that.
Yes.
So that's inflammatory kind of a back pain. And the another kind of back pain, what I need to emphasize here is that we discussed about the condition called as a fibromyalgia the other day. Fibromyalgia is a condition wherein the patient will be having pain throughout the body for no particular reason. They will be having tenderness at multiple spots. They will be feeling abnormal tiredness, sleep disturbances, anxiety and depression associated with that, and all this. It's a cohort. And once the fibromyalgia, as we discussed, if there is no particular reason, if it has been completely investigated, and if the doctor is not able to identify any particular reason for the generalized pain throughout the body, then they come to the diagnosis of fibromyalgia. And in this situation, fibromyalgia will be affecting the whole of the back. The other thing what I want to re-emphasize here is back pain and the neck pain or upper back pain, these are all segmental, in the sense that in a surgical kind of a back pain, it will not be there throughout the spine. Like it will be in a segmental basis. Either it will be in the neck, or it will be in the upper back, or it will be in the lower back. If the pain is going to be through and through in the spine, then on the balance, it doesn't come under the purview of a surgical intervention. Majority of the times, these are all non-surgical medical kind of back pain, which could be because of fibromyalgia or the inflammatory pathology, what we discussed about. So this is a nutshell about the various kinds of back pain.
Excellent. And almost all the causes of back pain you have covered. And you threw light on one particular thing, I think, which public is not aware of, maybe most of them, that even if you are not hurt yourself, or in spite of it, you sleeplessness and the continuous pain in the night, which has to be taken care. You should not neglect it and just go about to investigate what it is all about. So it's a very good point that you have reiterated today in this session.
Yeah.
I want to discuss about some of the myths that are there in the public, actually. There are quite a few myths. So let's have a discussion on that, whether it's really a myth or it has a meaning. First thing is the epidural injection, which is given during the delivery time. They give the injection in the back. So that most of them say, if you have undergone, a C-section, that you are prone to have back pain over the years. Okay, all the ladies. Okay, irrespective of whether you are put on weight or you have not put on weight, but it is going to happen. So the second question is, children nowadays carry a lot of books. It's just like a luggage that they are carrying, and they are going up and down in the floors. Schools cannot afford lifts, so most of them walk up to the classrooms in multiple floors. One other thing, and because of this, their back also gets hurt, and which parents at home and the elders keep telling that their back is getting hurt, and in future it will affect. Third point is, we have cycling and bikers all around. So go for expeditions and all. So generally, the posture that they have in cycling and all is so, it's like you use too much on that. And even bikers, they have the fancy bikes and all. They have this problem of, the seating, the posture itself is totally different. It's not erect. So if they are going to continue this for years together, will this affect their back, and will this have an effect on their, back pain in future?
Yeah, I can completely understand where you are coming from, and we do get a lot of referrals from other physicians regarding these kind of situations. Now, coming to the first issue that you spoke about, which is essentially a cesarean session for which people get this epidural injection. See, let me clarify. I'm not an anesthetist. I'm a spinal surgeon. What I need to tell you is, this injection of what the anesthetists are giving you is essentially a teeny needle, which we grade the bore, the width of the needle as 24G, which is almost equivalent to the say 10 times the size of a hair, human hair and stuff like that. It's not that big, and it's almost similar to the kind of needle that you get in the injection in your arm or in the back or something of that sort. Okay, so what happens is they give this injection through this between the two bones in order to reach the spinal space over here. This is where the spinal cord is going through. So, and they go there and they give the material over here. In this particular process, they don't go and hit anything at all. There is no dangerous structures or anything at all. If at all one dangerous structure is there, that is a spinal cord over here. Okay, and that's where we are planning to do the injection in order to numb the leg or the private parts where the baby is going to come out at the end of the day. So, like any other injection, like the injection what you're having in your muscle, in the arm or in the back and stuff like that, this epidural injection is given with a very small teeny needle, and it is not going to cause any permanent damage to any of the structures in the spine or anything at all. And last, like any other injection, like the injection that you're going to have in the arm or in the buttock region, this will also calm down over a period lasting anywhere between 24 to 48 hours, or the maximum of 4 to 5 days time. That's what it is going to be. In my personal opinion, on the balance, there is no permanent long-lasting effect because of this epidural injection. And the anesthetist, our anesthetist, they give this injection day in and day out, actually. And it is not just given for a cesarean section. Every day, in all the theaters, and anesthetists will be giving these kind of injections on a regular basis. So the myth is not just about the epidural injection given purely for the pain relief for the C-section alone. It is, they give this injection on a regular basis. If there is a problem associated with these kind of injections, then we from the medical specialty would never ever practice that actually. So it is an absolute myth stating that the injection that is going to be given for in the form of epidural for the C-section is going to cause the pain. And besides, I will also tell you one fact. We as spinal surgeons give this epidural injection in order to cure the back pain. So it's an oxymoron from if they understand what exactly I mean. So it's a myth actually. Now coming to the second scenario of school children, you are talking about. Of course, I have seen school children carrying big bags on their shoulder, etc. This category will come under the category of postural kind of a back pain, wherein they are carrying abnormal weight and in an abnormal posture. So, of course, it is going to cause back pain. It's a muscular back pain or a postural kind of a back pain that will come up to. But on the balance, this is not going to cause any permanent damage. This is a way in which the unhappy students and the unhappy parents can possibly tell off the teachers or stuff like that because of the amount of the homework that is being given. Sorry, I am not against you guys or anything at all. I do apologize. But what I mean to say is there is no long-lasting damage. But as much as possible, do not, to the teachers as well or to the school as well, not to ask them to take too many books in their carry bags to the school. That is very important. And the last one you're talking about is the pillion riders or the bikers or the bicyclists of the modern age, where all the modern bicycles and stuff like that have got a significant stooping posture in order to ride bicycles and stuff. Of course, this will come under postural kind of back pain. If we look into the category of the people who are going to be involved in these kind of events, they are essentially past teenage group and any group on the far beyond on that side. If I need to emphasize that if this particular kind of a people are going to have underlying degenerative causes in situ, and if they are going to be involved in abnormal postures, then of course they are going to aggravate the problem. On the other hand, if they are not having any underlying degenerative problem and per se they are going to do the pillion ride with an abnormal posture, on the balance, it is not going to give any long-lasting damage or anything at all, but it will lead on to pain for a small period of time. That's what it will
be. Okay. I think the basic doubts that we have, I think you've covered everything. Indeed, it was a very empowering section. Thank you very much, Dr. Prakash.
See, we will look into talking about in
detail.
Yes. Degenerative back pain. That is the biggest topic that we need to discuss about. And let's go into all the treatment options on multiple other videos that we are going to produce to you. Okay, then. Until then, bye-bye.
Thanks. Bye.